During my assessment of the SI joint in flexion, my contact point was the ASIS, and my line of drive was anterior to posterior. During my assessment of the SI joint in extension, my segmental contact point was the sacral base and the knee, and my line of drive was posterior to anterior and inferior to superior. The sacral base itself required me to use 6 different segmental contact points in different positions of the sacral base, both 2 in the midline and then 2 in line with the ASIS on either side. And my line of drive was posterior to anterior. For the thoracic vertebrae, my segmental contact point in flexion was the spinous process, and my line of drive was posterior to anterior. Both flexion and extension, and my pause it. And whenever in lateral bending, my segmental contact point was the spinous process, and my line of drive was lateral to medial. In rotation, my segmental contact point was also the spinous process, and my line of drive was lateral to medial as well. For my assessment of the articulating rib, the segmental contact point for depression of the rib was the superior border of the rib, and my line of drive was superior to inferior. My segmental contact point for elevation of the rib was the inferior border of the rib, and my line of drive was inferior to superior. For the cervical vertebrae, in flexion and extension, my segmental contact point was the interspinous space, and my line of drive was posterior to anterior. In rotation, my segmental contact point was the articular pillar, and my line of drive was lateral to medial. Also for lateral bending, I used the articular pillar as my segmental contact point, and my line of drive was lateral to medial.